So let's start with your name, the place where you are now in, and can you shortly say who you are?
Sure. My name is Holly Lassila, and I live in Pittsburgh, Pennsylvania. And I am an associate professor of pharmacy at the School of Pharmacy at Duquesne University. And I have a private practice in mental health counseling as a licensed professional counselor.
Mhm. So when you say, I don't know if I got it, I mean, so you are, um, you said professor, but I didn't get what is the subject, if you could.
Yeah, associate professor in the School of Pharmacy. So I am
Aha,
a
okay.
pharmacist by training. Yes.
Aha, okay. Pharmacist by training, right.
Yes. And then I
Uh-huh.
went back to school. Yes.
Okay. Uh-huh. Ah, interesting. Wow. Uh, and now you are at home, I believe.
Excuse me?
You are now at home.
Well, I'm teaching at the university. I go in for teaching. Right now, presently, I'm in my home, yes,
Mm-hmm.
doing this interview. Yes.
Mm-hmm. Mm-hmm.
And I'm
Mm-hmm.
also doing telehealth with my clients.
Uh-huh. Okay.
But I am teaching face to face with my students.
Even in these days.
Yes, we wear
Wow.
masks. The classrooms are much smaller, so we're doing an asynchronous hybrid type of model.
Uh-huh.
So we're in front of the classroom with a few students. People are all over campus or they're at home. Um, that's for now. So for the fall, the plan is for everybody to be back face to face.
Wow. Wow, that's amazing because in here, we are working online. I mean, with students, because I teach sociology at the university, and we've been working online for a couple of months actually. And I guess the next term will be also online. So it's
Okay.
wonderful to hear that you
Yes.
are. Wow, wow. And I guess with maybe with your area with your domain, it is really needed. I mean that you need to see each other. You need to be in the same place. No, it's somehow inevitable, or I don't know, very important. This is what I'm trying to say.
Yeah, so like I said, we're face to face in the classroom with a few students. We have large classes of pharmacy school, about 120 to 140 students.
Hmm.
So we're making sure that we only have a certain number of students in the classroom, and they rotate through weekly. So,
Uh-huh.
but
Okay.
face to face with patients or clients is all still done telehealth.
Uh-huh. Uh-huh.
Yeah.
Mm-hmm. Mm-hmm. So with clients, as you said, so here people, I mean, like the practitioners here in Poland, they meet face to face. Some of them, at
Oh,
least.
okay. Okay.
Mm-hmm. Mm-hmm. Well,
Yeah, some people here are, I think, but the majority of us are still staying telehealth as long as the insurance companies are covering.
ah, sure, sure. Mm-hmm. I understand. So, yeah, I wonder. So, your relation with Gestalt is what you said you came back to school, and it means that you started Gestalt training, or what's the?
Yes, so I guess it's been about 7 years or 8 years ago. I decided to go back while I was
Uh-huh,
at Duquesne and get my 2-year degree in mental health counseling.
uh-huh,
And then I did my internship and practicum. And during that time, I met a woman by the name of Christy Carnahan, who
uh-huh,
is affiliated with the Gestalt Institute. She was actually in the program. And during some of my training with her in my practicum, we worked together in a women's shelter for partners of intimate partner violence.
uh-huh,
And she mentioned the training she was involved with doing the program and was said I should do it at some point. So after I got my LPC and some things got squared away personally with being able to take one weekend a month, I jumped in. So that was 2 years ago, and I just finished the program this month. Yes, 2 weeks
ah,
ago.
wow, uh-huh,
So yeah, so I guess I was a therapist for about a year,
uh-huh,
and then I started the training for the program.
uh-huh. Okay, so I will ask you, as I said before, I will ask you later about this. And I would like to come back to you and ask you, yeah, how would you define yourselves, yourself in terms of your values, in terms of your passions, who you are as a human?
So you're asking me that question?
Yes,
Okay, so say those words again, please.
yes. Who you are as a person in terms of your values and in terms of your passions.
Okay, so um, values, I think the first thing that comes to mind, as we're looking at figures here, that comes up for me is honesty and integrity.
Mhm,
So that's a very important value that I try to hold very dear to me, and teaching my children the same. My passions, oh, I love to be able to interact with people and watch them grow. I think that's one of the reasons that I enjoy teaching so much, is because in watching students have their awareness moments, as I do with my clients. So helping support that ground for that to occur is a passion of mine. Personally, for me, passion, I like to continue to learn. I guess I'm a student forever and ever, always looking for ways to grow and integrate new things into whatever I'm doing. Um, I'm bouncing back and forth here. So I value loyalty. I value honesty, like I said, integrity. Um, Community is very important to me. I think having that supportive community of people, especially as we come out of this pandemic, I think many of us have realized what is important as our core, and what isn't necessarily what is energy draining.
mhm,
So for me, I would say honesty and loyalty and support and compassion.
mhm,
I think we've learned a lot about ourselves in this time of the pandemic. I know I have myself, of how to be compassionate to myself. So
mhm,
self-compassion.
mhm,
And that's an area that I'm getting a little bit more passionate about, is how to give myself compassion so that I can be more compassionate to others.
mhm, mhm. And the next question is, well, what shaped you? What influenced you the way you are today? What circumstances? What kind of people?
Yeah, so thanks for asking that question. That's a really actually very powerful question.
Mm,
I think sometimes our obstacles have influence. For me, I'm going to say myself, my obstacles have influenced the person I am today. Um, there were a number of challenges throughout my life, as most people have, but for myself. And so I feel that by continuing to move forward and continuing to have goals,
mhm,
have allowed me to continue to be the person I am. I think that we all hit I call them speed bumps, which are our
mhm,
obstacles and challenges. And for me, what I've been able to do is to look at them and determine how to work with them in a way that has allowed me to continue to grow. So, for instance, if I have one door that closes for me, instead of pushing on that door and pushing on that door and pushing on that door to open, that may not be the best place for me, such as a job or a relationship. So it's being able to sit with that challenge or the obstacle and invent, create, be aware of new ways to get around that. And so what that has taught me through um, some of the obstacles is that I feel very blessed to have had them.
mhm.
I may not in that moment have felt blessed, but as we all do, looking back on things, it becomes our wisdom. Hindsight is our wisdom. So, I think just for me turning those obstacles into opportunities. And I know that sounds very cliche, but that's essentially what I feel like I've been able to do,
Mhm.
to give me the grounding and the ability to see things, what I hope to say are somewhat open-minded,
Mhm.
that supports me being able to hold space with other
Mhm.
clients.
Mhm. 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 Um, can you think of anything else? Anyone else that have shaped you for all these years? Oh,
So I had a number of mentors
uh-huh.
that have, been figures for me in my work life. People that have come along the way. Unfortunately, some of them have passed too
Mhm.
early. They've died,
Mhm.
but they will always be in my heart. And I feel that taking their support and their teaching and their advice and moving that forward with myself and also the individuals I interact with has helped support me.
Mhm. Mm. Mhm. Um, yeah. And so coming back to Gestalt therapy, could you say more how it all began? Because you started, you
Yeah.
said some words, but I'm interested generally in your story.
Yes. So as I mentioned, I was,
Hmm.
it was, it was brought to my attention by somebody who was one of my supervisors, and she was
Hmm.
in the program, and she said it was life changing for her. And so when I finished my degree at Duquesne, I felt that I had gotten, this is my counseling degree, I had gotten the basics to
Hmm.
work with patients and clients. But I still felt like there was a whole lot of things that I wasn't sure what to do. And um, I found that I was hungry for support and for more training. And I was looking for something that was integrated into a program that would allow me to grow. I keep using that word, to grow, but to get more knowledge to help my clients. So
Hmm.
I knew Dr. Krasinski from school. She was one of my professors at the School of Education. And so I knew that her husband, Dr. Patrone, he was the head of the Gestalt Institute. And I really didn't know much about Gestalt therapy. So I did a little bit more research on it myself, and it intrigued me in a way that, so the I've done a lot of work with Eastern philosophy
Hmm.
as a yoga practitioner, a martial artist, um, Reiki master, and so I really felt Gestalt had an Eastern component to it, which was just about being in the present. Very simple, but yet very profound and not complex. Like I think sometimes in the Western mind, and that's how I was trained as a pharmacist, our model can get very complex, and
Hmm.
we're looking at symptoms and we're not looking at the root. We're not looking at the base. And what I found that Gestalt did was it kind of took both those worlds, the Western and the Eastern, of my knowledge base, and it put them together in a way that allowed me to be more present with my clients.
Hmm.
And so as I learned a little bit more about Gestalt, but still very confused, it was very murky to me, the
Hmm.
concepts. Um, I did some more checking with other individuals, and they were like, yeah, you either love Gestalt or you hate Gestalt. And some were like, I love it. I did the training, and some were like, it doesn't resonate with me. And I think that's fine. And if you look at the literature, there's more CBT type of modalities because that's what's been tried and true in the scholarship arena. So it was funny because as many things that have happened in my life this way, when the opportunity presents itself and it's time,
Hmm.
everything else will line up. So financially, schedule wise, everything aligned to be part of this past cohort. And so my first weekend there, I knew I was exactly in the right place. I felt that the faculty, Dr. Patrone, Dr. Krasinski, the rest of the faculty there would exactly what I needed from a master level clinician. You know, I was looking for support, supervisory support that I could lean on, but also could continue to teach me counseling, but also allow me to grow internally too with my awarenesses. And I think that first weekend allowed me to appreciate this is where I need to be. It's not going to be easy. It's going to be a challenge. But again, from my history and my journey, when I have a challenge is when I do my most growth.
Mhm.
And I felt that the more you put into a program like that, especially as an adult learner, you can either sit back and observe and watch it happen, or you can get in and get your feet wet and get dirty and, you know, whatever, and learn and grow. And that's what I did. So we used to call that, one of our faculty members called that being a leaper or a creeper. And I'm an introvert, so I always felt I would be a creeper. But I said in this experience, I need to be a leaper. I needed to do something different than I've done. And so that kind of is how I came to Gestalt. And it's funny because it's taken me 2 years to really embrace it and integrate it. And I'm a novice integrator, but it has shifted my being on the inside.
Mhm.
I so resonate with this type of therapy and technique and art. And it is an art. I think it's an art. You know, I come from a world where we have algorithms and guidelines,
Mhm.
you know, as a pharmacist in the medical model, you know, you follow. And so this is an art because you never know what's coming out of a client's mouth next, and you're walking with them during that journey. And I can tell you that I have changed the way that I teach because of Gestalt therapy.
Mhm.
Um, Much more humanistic.
Mhm.
And you know, I've had a history where I have done a lot of work with vulnerable populations. I work with hospice patients. I have worked on the streets with homeless patients. I've worked in rehabilitation places and women's shelters. And I've always felt like I was holding space, but not like I have been able to get to the depth of that now after doing the training. It's been a
Uh-huh.
profound shift.
Uh-huh. Yeah, I'm interested in that part. Can you say more about your experience with those different communities and
Yes.
and how Gestalt? I mean, the way you learned Gestalt, the way you were taught Gestalt, you experienced Gestalt, how it shifted your way of being with people and the way of helping them. Can you say more simply?
Yes.
I'm
Yes.
interested. Hmm.
Yeah, so I'll start. So, you know, when you work with patients who are vulnerable in the respect that they've had situations that have kept them from being in situations. So I'll speak on the patients that I work with, the clients
Yeah.
that I've worked with as a pharmacist when I've worked on the streets,
Hmm.
the street homeless patients. Um, you know, this is a population that not everybody wanted to work with, and
Yeah.
I
Hmm.
found a passion. So it was working with vulnerable populations. And I think, you know, when I would have my students say to me, why are they like this? Why are they like this? Why are they in this situations? And I remember I would get upset internally with my students with why and they, but I couldn't figure out a way to reframe that for them to ask the question differently and to understand what they were getting at. What Gestalt has taught me is to say, what about this experience is causing you to ask me that question, or is generating that? So what it does is it allows me to get a better understanding of where somebody's coming from
Mm.
and have them really get in touch with what about this experience is making me feel different, uncomfortable, happy, joy, whatever that may be for them.
Mhm.
So I feel that I have learned, even as a parent, I have two teenage boys. I'm a single mom, two teenage boys,
Mhm.
and my one son was going for his job interview a couple weeks ago, his first job interview, and he was very anxious about it. And when he gets anxious, he starts, getting a little angry, um, and was kind of lashing out. And so instead of me getting angry back at him with "stop acting that way," I said, "What are you noticing?" And it kind of just deflated the whole escalation of what it could and has turned
Mhm.
out to be. So I've been able to, I call it the dance, the partnering dance that you join and you kind of like do the dance, the
Mhm.
rock back and forth energetically and with words. And so, as I look back at some of my experiences from the past, and I think I have learned, I've grown, it's using different language to reframe and gently, um, how can I put this? Shift. So
Mhm.
as I shift, it allows me to ask questions in a way
Mhm.
that helps my client, my student, my child, whatever that may look like,
Mhm.
shift.
Mhm. Mhm. And if you were then to answer your students, what your answer would be today? If I wonder if you could.
So for the question of, why are they in this
Mhm.
situation? And so I would ask the student, what about the situation? And um, I work with now presently, I work with people who are from other countries,
Mhm.
a lot of refugees and
Mhm.
immigrants in
Mhm.
the city of Pittsburgh.
Mhm.
And so I get some similar questions from my students. And so my answer is, typically I find out what is causing them to be uncomfortable. And then we explore that. And,
Mhm.
you know, so to go back to the first situation, working with, street homeless patients and individuals, often it's not by choice they're in these situations.
Mhm.
Often they've had a series of bad luck without support. And people don't realize where they find themselves. And so it's, one of the things that I explain to people is it's not always a choice.
Mhm.
People don't always have a choice when
Mhm.
bad things happen to them. And if you don't have the support and it's not your choice, sometimes we fall down, but we can get back up. And the important thing is that we're the support.
Mhm.
Um,
Mhm.
so, for me, you know, Dr. Krasinski and I were talking about this last week in our supervision class, is that, the transformation, the
Mhm.
transformative process of, especially of Western medicine and the way
Mhm.
we
Mhm.
train
Mhm.
our medical people.
Mhm.
Again, it's, not algorithm driven. Okay, you're patient number
Yeah.
one who's been in the waiting room, you're on these medications.
Mhm.
My goal is to allow my students to see a person, as a human being that's a holistic piece.
Mhm.
So, it's funny you asked me at the beginning about one of my passions. I'm a believer of holistic practices
Mhm.
and not silo. I'm not a
Mhm.
silo, and and so that's one of that's where I come from, as a place of holism.
Mhm. I guess I asked you because how to put it. Yeah, I guess it's so important, and that's why I reacted so enthusiastically when you said that what's your first domain? I mean, like pharmacy. That I like it that so different people are coming to Gestalt. Because like I don't know for me as a sociologist, those issues are, I mean, at least theoretically clear that people don't they don't choose things, but it's another thing is theory, another thing is practice, and
Yes.
that's
Yes.
one thing, and another is that we need, like, I mean, there are so many professions that, like medicine and that needs that kind of input, that kind of insight, knowledge, that humanistic, holistic, as you said, approach. And it is, I mean, I know it, but thanks to you, I can learn from your experience. I mean, how it's been for you, because as I imagine you as a person, you have those kind of trait qualities that somehow encourage you to go to the streets and and help vulnerable people. Uh, this is you, but then with Gestalt you can even be, I don't know, grow more and help them more. I yeah this is yeah this is great. I mean, this is very important, this kind of, I mean, attitude, but also this kind of approach, this kind of belief, um, as you put it. I mean, for medical professions.
Yes.
Yeah.
Oh my gosh. Absolutely. Absolutely.
Here in Poland as well. I mean,
And that's one of the things that I've really want to do with my scholarship. So, as part of an academic professor, we have to do research scholarship. And I really want to merge. I've seen the benefit of my journey
mhm,
with the care and my just the skill set. And
mhm.
I want to be able to merge that into scholarship to be able to bring that into more of mainstream, the Western way of teaching
Yes,
and learning for
yes,
students.
yes.
Uh, but as you said, not everybody and they see what they think is holistic. So not everybody, you know, embraces that.
Hmm.
So it's going to be, but that's okay because as I said, I like challenges and I like obstacles and they bring opportunity. So
Yeah, yeah. Thanks for mentioning that too, because from the very moment that you mentioned, actually, that Gestalt also influenced your way of teaching and being with students. Well, I couldn't agree more. I mean, yeah, because these are like uh, apparently small elements that you somehow include into the contact in communication, and that changes a lot. Even though I was complaining about online contact, and I still am about this online contact with students, but my kind of experience, how to be with other people in a group, somehow enables me to be with those people, even though it is for them it is even more difficult to be online and not to be with others, peers, simply.
yes, yes,
So it is really important also on this, to somehow to support this ground, this
yes,
online ground,
yes,
and
yes,
then
absolutely.
be interested in teaching. But yeah, yeah. So I can that resonates a lot, what you're saying here. And I can agree that it is a challenge, and especially I imagine for medical students. Yeah, wow, cool. Okay, um, you said that you are a community person, and I am interested in that, because could you say more what it means for you?
So when I say community, I like being part of a group um, of people with common interests. As you can imagine, I came through, I'm going to use the old way of talking, left brain model
Mm-hmm.
of education, but many of my passions and things I love are very right brained.
Uh-huh.
So, yoga and
Mm-hmm.
martial arts and energy healing and meditation. And, as they find their ways into mainstream left brain because we're researching them, they're still, you know, um, looked at as, we're integrating them more, the healing modalities, even, you know, the spiritual piece of that. And so for me, I feel very comfortable when I'm part of a community that has that common ground.
Mhm.
Um, and I think because I spend some time in communities that don't have common ground for me.
Mhm.
So it's important to feel
Mhm.
warm in you know, in a community that we speak the same language,
Mhm. Mhm.
than always having to feel like I have to explain my language.
Uh-huh.
So it's
Exactly.
in a community that gets it versus a community where um, it's not something that they necessarily resonate with.
And are you speaking now of academic communities, or you find it, I mean, because for me, for instance, it is much more difficult to find a community within academia, and it's a lot of easier to be part of community within Gestalt or
Agreed. Yes.
world.
So I will say my counseling communities, Gestalt community, I think that, you know, my yoga communities, my healing communities, I think within academia, there's pockets
Hmm.
of communities within um, departments,
Hmm.
but I don't necessarily think it is. I think academia has changed a lot in 20 to 30 years. I have a PhD in epidemiology. I went back to grad school in 1987, 88. I graduated pharmacy school in 86. So I was in grad school in the 90s.
Hmm.
And academia is very different than it is now. It's
Hmm.
changed a lot. I
Hmm.
think academia has gotten financially driven,
Hmm.
and it's a sign of the times. I'm not, you know, being critical. I'm just seeing what I see. And so with that came a change where I think we lost some of our community,
Hmm. Hmm.
of creativity and academic freedom and everything that we experienced back in pre 90s.
Yeah. Mm. Hmm. I agree. And unfortunately, yeah. Uh, well, but as you said, with students, it is possible. So maybe with the time, I guess maybe it will be again possible. Even there are so many obstacles, like like the one connected with the way of the financialization of universities, marketization, and so on. Maybe maybe the new trend will be something
Yes.
something new. I mean, yeah. What could be worse? I guess maybe.
Well, I think students are demanding a shift too. I see
Hmm.
students, I
Wow.
see
Yeah.
my own son, he's heading to college next year. They're I say they're marching to the beat of their own drummer. They're they have their heads on straight. They have an energy, a vibration about them of what they want and what
Hmm.
they want the world to look like. And I think that's going to shift things again. I don't think they're going to stand for what is
Hmm.
happening. Um, I think they bring fresh ideas. I think they bring new ideas. Some even challenge me at this point. But as I take away my own, deal with it, and I look at it and I say, huh, okay. And they're the ones that are going to be living in the world a lot longer than I will. Um, you know, and I see students not going to college like they used to. I think they're making different choices and
Hmm.
different, you know, delaying it. And
Hmm.
honestly, I'm curious to see what this pandemic has done
Hmm.
to these young people, and not in a negative way. I think
Uh-huh.
it may be in a positive way once the world starts opening up again. So I think students are starting to demand a different way of
Hmm.
academia.
Hmm.
And so they may change it. We
Hmm.
can't. I don't think we're going to do it. I think it's the students that are going to demand it,
Hmm.
the
Hmm.
customers of the service.
Yeah, yeah. I like this perspective. I mean, yeah, it requires an openness, no? Kind of
Yes. Yes.
bracketing.
Non transparency. Exactly. They want to know what they want to know. They want to know, what are you doing? What are you teaching me? And why are you teaching me this? They want an understanding, a foundational understanding,
Yes.
much more than I you told me to do something, I did it without question. That
Yeah.
is not this new generation. It's a
Yes.
very,
Yes.
yeah, they're inquisitive and curious.
Mm-hmm. Mm-hmm. Wow, wow. Even, whether in the US or in Poland, I guess we think we are observing the same phenomena, I believe.
Yes, good. Yes.
Wow.
Yeah. So I'll be excited to sit back and watch them take over.
Wow. So, thank you. I guess that's it. I wonder what's your future now. Maybe this is, I don't know if you consider it a question, but now that you finish your program, uh, what's your next step?
Yeah, thank you for asking. So I had just got an office open, which I
Hmm.
haven't been in yet because of the pandemic, but it's in the Gestalt Institute.
Mm.
And my goal is to take their advanced training
Hmm.
and then progress in whatever opens up for me after the advanced training with them. So
Hmm.
just continuing to, my goal this summer is to really take a deeper dive into some of the Gestalt literature,
Hmm.
things that I haven't really been able to do because it was very murky and it still may be very murky, but, do more understanding of the literature and see what's been written. It was confusing for me to do that at the same time I was doing the training.
Yes. Yeah,
So
I know
yeah,
what you
yeah,
mean.
I took a look and I'm like, yeah, not yet. So, so it's just to continue to grow and help clients and get my supervision and stay connected with the Gestalt Institute. Tom and Mara are just amazing, amazing, amazing people. And Tom, especially taking this institute to a whole different level, and Mara with the educational piece and all the faculty that are involved. It's really been an amazing experience, and I'm
Hmm.
very blessed to have had it. And I've told them this too. I feel very blessed to have had this community through the pandemic.
Hmm. Wow. Yeah, exactly.
How fortunate for me to be able to stay connected with a
Mm.
group of people through this whole process, because I
Mm.
know not everyone had that opportunity,
Mm.
and became very
Sure.
fragmented. So
Sure.
yeah.
Sure. Sure. Isolated. Yeah. Miserable. Yeah. Okay. So thank you very much. Good
Thanks,
luck.
Camilla.
Good luck
Thank you.
with
You too. It was
your future.
so, what a dear to meet you. It's been really a pleasure. Thank you so
Thank you.
much.
Thank you. And enjoy, enjoy your day this ahead
Yes,
of
you
you.
too. Thank you.
Yeah.
Enjoy.
So goodbye, and I will email you. Bye
All right,
bye.
Camilla. Thank you. Bye-bye.
Thanks.